Hello, my name is Kate Bowman, and today I'm going to be in conversation with Joe Costello, who is an Admiral Nurse supporting people who are affected by dementia. We're going to talk about his role, and we're going to talk about the impact of dementia on families and carers. So, Joe, it's lovely to meet you today. Thank you for joining me.
Good afternoon, Kate.
Can I start by asking you what your role is as an Admiral Nurse?
Hi, Kate. My role as an Admiral Nurse is to work with carers and families affected by dementia or living with dementia. I'm a registered psychiatric nurse by background with experience in older persons' mental health, past roles of working in the NHS, roles involving memory services, diagnostic, post-diagnostic support, case management, care coordination. In this particular role, the lead Admiral Nurse have been employed for 3.5 years with the charity Dementia Matters, who, in partnership with Dementia UK, who provide our professional and practice development, recruit registered nurses with dementia experience to provide the support to carers and families. I'm part of the wider group of Admiral Nurses that are in place in NHS, local authorities, they're in charities, hospices, hospital and acute care, primary care. As I say, my role at present is working with the charity Dementia Matters, who provide dementia specialist support services in the community in Newcastle, including home care, day service, respite. So the Admiral Nurse really fits the model of support in providing dementia specialist care. Over the last couple of years in post, we've created the Dementia Advice Centre, where the Admiral Nurse has led a team in the delivery of care and support to people affected by dementia, including the carers and families. The Admiral Nurse has a specific role to work with the carer and work with a family or a family member or a partner around the complexities of living with dementia. Often the Admiral Nurse gets involved where there is high levels of stress and strain in carers and their ability to continue in their roles and cope and manage. And often where there is complexity in the dementia, the person with dementia is demonstrating significant changes that is maybe leading to breakdown or challenges in the caregiving role.
Are there multiple ways of referring into your service?
There is multiple ways of referring in. This is quite a unique service where people can self-refer without having to see a GP or be referred from another professional. They can drop in to the Bradbury Centre where their details can be taken, and one of the team can get in touch with the person. They can go online and make a referral, a self-referral. Professionals can refer in, GPs, social workers, nurses in the community mental health team, the acute hospitals, the community sector. People could come along to the peer support groups that we had been holding prior to the pandemic and get the support and advice from the specialist team, including the Admiral Nurse. So there's multiple ways of accessing the service and being able to do it independently without seeking a health or social care professional is great for the person.
At what points do you sort of touch with the carers organisations and the other support services in the city?
That's a good question, Kate. I think from the point of diagnosis, we work very collaboratively. We work in partnerships. It's often maybe at times when people are looking for different types of services. So, for example, with living with dementia, people might need advice on entitlements and financial support. And so again, we'd be linking up with the council, and we might be linking up with the third sector, the voluntary sectors, organisations like Search, Newcastle Carers for specialist support and advice. It's very important in the role of the Admiral Nurse, where we're working collaboratively to help meet the needs of people affected and living with dementia, especially carers. If there's groups going on in the community, we try where possible to engage and participate with the group, so to maybe do a joint project